what was your journey?
I did not want to do medicine. I will join medicine, but I won't study well. That is how I entered into medicine.
When you were an 18-year-old student who started with MBBS?
A one-liner for all undergraduation students. It is all about conceptual learning.
People, often think that, okay, doctors should marry doctors.
I don't want a doctor as my life partner.
Really, money is that important?
Yes.
Hello everyone, welcome back to the channel. So today we have with us a very special guest and a very special podcast series for all of you, in which we will go retrograde manner like we study, in medicine particularly. So we will go in the retrograde manner to discuss the journey of Dr. Shanmuga Priya Ma'am, and in her entire journey, what are the key takeaways, what are the lessons that you can incorporate right from if you're a medical student to someone who is watching this in residency. We will cover it all. Thank you so much, ma'am, for joining. We all are elated to have you on the channel.
Thank you, Akshat. Thank you for bringing me to your channel. It's my pleasure.
So I think everyone already know about you, ma'am, but just a little bit of introduction. So ma'am is basically has completed her MD Biochemistry, and she is currently formerly the Professor of Biochemistry at TK Medical College, and also she has been involved in various other activities, like she is Director and Chief of R&D Department at Kriya Medical Technologies, and also she is an educator at Prep Ladder. I think most of you know her from there as well. And this is not only this much, she is also founder, and she manages Namma Ooru Global Schools, which is again something CBSE school in Tirunelveli, and that is really amazing. So ma'am, first question will be straightforward to you. This only key, how do you manage so much thing in a particular day?
On a particular day, it is like, as you rightly introduced me, I was formerly the professor. Now I'm no more associated with any of the medical colleges. Right. And full-time working as a director and chief of research and development at Kriya Medical Technologies. And that is where most of my time is spent. So on a regular weekday, starting from 9 a.m. till 5 p.m., I'm at the factory wherein I design and develop molecular diagnostic kits. We also manufacture blood collection tubes. So I'm at the factory wherein I take care of the production part, I take care of the QC, quality assurance. And apart from that, we are also involved in designing and developing a new molecular diagnostic kit for multi-drug resistant TB. Okay. And as you said, yes, I'm also a founder of Namma Ooru Global Schools, which is a CBSE school in Tirunelveli. And this I do after my work time on a work day. So post my research and development work, when I come back, I do this only remotely. I'm right now in Chennai, and the school is in Tirunelveli, and the Tirunelveli school is managed by our principal. Okay. And I take care of the academic activities, and on a regular basis, I don't take part in the operational, at the operational level, I don't participate. But for academic activities, yes, I have an active role to play. So that happens after my work time. And yes, Prep Ladder, we have regular recording sessions for both regular videos and rapid revision videos. And we also have work to do as far as QBank is concerned. And that happens on a mutual understanding, right? So Prep Ladder gives me regular time, appropriate and adequate time for me to work on it. So in the evenings, I do that work. Okay. And apart from that, yes, I also take offline sessions, which happen on weekends. So roughly, I manage all these tasks. As it comes, I take it.
Right. So I think, ma'am, it is rightly said that, once you do a job, you are working 9 to 5, but once you are, starting something of your own, you are working 9 to 9. So I think that's really the case. So let's begin with the podcast, ma'am. The proper theme is that we will go step by step, right from the basics of your, medical school to present day. So let's go back to 10, 15 years, earlier, when you were an 18-year-old student who started with MBBS. So what was your MBBS journey, and how do you felt in medical school? Maybe you felt that, okay, this was the mistake that I committed. This was the best part that happened to me. Something related to your medical school journey.
Okay, that's interesting for me to go back and look at what I did previously. If you ask me as an 18-year-old girl, right, was I interested in getting into medicine? I was not. Okay. I did not want to do medicine. I wanted to do physics. At that point of time, I thought physics is the most interesting subject. So my passion was to do physics, but my mom wanted to live her life vicariously through me. So she wanted to become a doctor. She could not, and so she decided that I should become a doctor. And that is how I entered into medicine. And so when I entered into medicine, my mom is strict. I cannot go against her. So what I thought was I'll get into a passive-aggressive mode. Right. I thought I will join medicine, but I won't study well. so that my mom would understand that I'm not cut out for medicine. And I thought she would take me out of medicine, put me back in physics, was my strange plan that I had when I started MBBS. So the initial 4 months, I did not buy any of the textbooks. I did not have anatomy, physiology, biochemistry, nothing. So all my internal assessments, I flunked. I failed every internal assessment for the first 4 months. But then there was a table tutor for me, Dr. Ravi Kumar. So he understood that I'm on a self-sabotage mode. So he thought he should straighten me out. So he started, I mean, I won't say it was not, I mean, at that point of time, I thought he was targeting me, but now I understand that he had a goodwill for me. And he wanted me to study properly. So everything would be my name. If it's a seminar, Dr. Shanmuga Priya, not doctor. If it was a seminar, it would be Shanmuga Priya. If it's a dissection test, my name would be the first. So only to face him, I started studying. And when I started studying is when I understood how relatable medicine can be. So I understood how applied medical subjects are. I realized that apart from or beyond physics, there are many more subjects which can be interesting, like anatomy, physiology, and biochemistry. So luckily for me, when I was learning, it was thorax dissection that was happening. And around the same time, I was also asked to present on coronary circulation. And I had also to learn about cardiac markers. So I was able to link all these three. And when I started learning, I understood that medicine is interesting. And from then on, no looking back. Once I understood that's interesting, I started putting my heart into it. And during my MBBS, I mean, my experience would be totally different from most of you here, because the first year went on like this, and then I realized, and then I started studying. And then second year, first clinicals, pathology, pharmacology, and microbiology. I had just started preparing for the exam. That is when I got engaged. I got engaged in my second year. And then in my final year, I got married.
Okay.
And yeah, so it was a totally different mixed up feeling for me when I did my undergraduation days. But throughout my undergraduation days, I did not lose my interest for medicine. So every subject, it would be like, if I start learning a particular topic in pathology or pharmacology or any subject for that matter, I would not turn the page until I understood that page. When I say understand, it should be a conceptual understanding of all the topics. So that is how. Of course, during undergraduation days, I don't think it helped me a lot, because at that point of time, it used to be like you have to finish everything in a particular framework of time, right? I never finished any subject within a defined framework. I would always need more time for me to finish a subject, because it used to be, I mean, for me, it's always conceptual understanding. But as we started applying medicine, surgery, and OG, I understood the way I learn is the way it has to be learned, because I was able to apply it in a better way than those who learn it in a factual manner. So if you ask me a one-liner for all undergraduation students on what philosophy I would want students to follow, it is all about conceptual learning of all subjects. Don't get into factual or rote way of learning. It has to be conceptual learning. So that is about how my undergraduation went.
Okay. So I think, ma'am, this was a very insightful answer, and I think it covers, I think 30 to 40% of medical students are somewhat in that range, because, it's not possible for every 18-year-old to figure out what they have to do with their life. And many a times, it's also parental influence that plays a major part in it. So I think you have, carved out a great journey through your skills and what your passion is. But it is very important that you got to know that, okay, whatever you are doing, do best in that. And then eventually you can, figure out what to do later in the life. So now we go another step. You gave your at that time maybe PG exam was there, or through MBBS only I think admissions were happening in the PG section. So what was your thought process when you took biochemistry, especially like you loved physics? So I think biochem doesn't offer much of your physics part. Some branches like maybe nuclear medicine at that time, I'm not sure if it was evolving at that time. So what was your thought process of choosing biochemistry, and how you maybe told this to your family members who always wanted to be a doctor and practice something like that?
Yeah, so we had an entrance examination. It was not based on undergraduation marks that we got the branch. We had all India entrance, we had state entrance. It was not, of course, NEET PG. It was called as all India entrance and state entrance, right? So I had a decent rank. So as I told, I got married in my final year, and I delivered my daughter 30 days after finishing my internship.
Okay.
And when I wrote my entrance examination, my daughter was 45 days old. So so when the way I chose biochemistry is based on my understanding of my skill set. I knew surgery is not an option for me because I have butterfingers, my dexterity is bad. I don't have that skill at all. I knew that. So I did not even look at surgical sites. So I had chosen it to be on the medicine side. And when it came to medicine, I could not even imagine leaving my daughter behind and doing a night duty. So I thought it should be a non-clinical medical subject. So, but at the same time, I wanted to be involved in managing a patient. So I thought it should be a lab medicine. When it came to lab medicine, pathology was out of question, because till now I had never been able to see a slide and identify a slide. Okay,
Right.
probably I
think we
put
all
my
can
mind.
relate with it. Right.
Yeah, all of you can relate to it, right? So I knew anatomy is not for me. And then microbiology, I did not want to learn about microbial organisms. I wanted to learn something different. And my understanding of myself is I have some analytical skills. So I thought if I get into biochemistry, I will be able to analyze a report and give an interpretive comment on the report, and I can be actively involved in the management of a patient. That is how I chose biochemistry. And when I chose this subject, biochemistry, it was much against the will and wish of everybody in the family. So my father-in-law was totally against it, because he wanted me to take a clinical subject.
Right.
And but this time I decided undergraduation was not according to my wish, but post-graduation has to be according to my wish. So I gave him two choices. You choose biochemistry for me or FM.
Okay.
I knew he will not choose FM for me. So it was almost like get lost, do whatever you want. That is how he said, okay, for biochemistry. But I chose biochemistry this way. But now the same person who did not want me to choose biochemistry is so proud of what I'm doing.
Right.
I'm not claiming to have achieved something great, but he's happy about where I am. He's a doctor. He was the dean of medical college. So he is happy about the translational research, which I'm part of. So the take-home message for anybody who watches this video is, do not choose anything based on what your seniors say, what your family members say, what others feel is important, what others feel is great. It should be chosen purely based on the skill set that you have, and it should be based on what passion you think you have based on your experience till now. And if you choose that way, no field is less and no field is great. It's all about the passion that you have for the field that will determine the success in your life.
Right. Absolutely amazing, ma'am. And in fact, when I have personally watched your prep letter biochemistry lectures also, so I also felt the same way. Ki once you start to learn things the right manner, then every branch will, make you fascinate about its beauty, and then you need to see that what fits all the criteria, right from personal life to professional life to maybe even after 20 years, because at that time everyone think that okay, we will do night duties, we will do hectic work, but eventually there are times when you need to, manage your personal life as well as professional. I think that was a great sum up. And Abhi, still we have left with one round of counseling. So if someone is watching this, maybe they can again think on their choices. So that's really nice of you, ma'am. So now this again, I think you have answered, but this again, same thing happens when residents, when aspiring residents want to know about a particular branch. The first question usually is how much is the earning, right? So like if we say about biochem or say any paraclinical, preclinical, usually people think that okay, you will become a professor, maybe you'll become an HOD. There will be a cap of say 2 to 2.5 lakhs per month. But personally, as we saw, you have such a diverse portfolio. So what would be your thought process? Ki really money is that important, or first thing that one needs to figure out is being happy, because struggle will be there, but you need to be happy to do that struggle too, right? So what will be your take on this particular notion? Because right now everything is about like people are asking how much money is this in branch, and then every branch is saturated. So this is a very loop which is everyone is just going through it.
Yes. If your question is, if you choose biochemistry, will you be happy? I would say 100%. And I am on top of the world. Okay. So if you ask me, are you happy about the profession that you have chosen for yourself? I'm totally happy. So as I started this interview, not everybody should get into radio diagnosis to be successful in life. I have nothing against radio diagnosis. I'm just giving you this as an example, because it is one of the most sought after courses, right? So in my case, I joined soon after I finished my residency. So during residency, was I happy about my course? I was totally happy about my course, mainly because I got interested in analyzing all the reports. I got interested in wet lab chemistry. If you're asking me what is wet lab chemistry, it is more about getting involved in analysis. Okay. So after sample collection, what is being done in the lab? So sample is getting processed and sample is getting analyzed by analyzers. And because I had a passion for physics and chemistry, I got involved in how analyzers work, how analyzers give away reports, and how to check the QC, quality control, and quality assurance of those reports, how to interpret those reports.
Okay.
And if I see any interesting or unique report, I would not sit in the lab. I would see where the patient is. I would go have a look at the patient. I would read the case history. I would be actively involved in the management of the patient. So during my residency, I got interested in inborn errors of metabolism screening. And I got myself trained in HPLC with tandem mass spectrometry, how to interpret those comments. So that was one period in my life wherein I thought everything is about inborn errors of metabolism. I got myself indulged into those disorders. And then it was all about molecular diagnostics. I got fascinated by molecular diagnostics. And I would like to tell everybody here that the college in which you study a course does not matter. Okay. I see that people getting worried about not getting the seat of their choice in the most prominent medical college. Yeah, I've seen students asking me, I'm getting this particular course in a periphery. Should I go and join, or should I wait for one more year for me to get it in a prominent college? Should I always study in an institute of national importance, right? Should I always study in AIMS? Should I always study in JIPMA? Should I always study in PGI? I know people who are in AIMS and PGA or JIPMA would not like my answer, but the college in which you study does not matter. Of course, you might be thinking, if I study in an institute, there will be all instruments, all equipments which are essential. But where I studied, Madras Medical College, yes, it's an institute of biochemistry, but at that point of time, they did not have chromatography, they did not have mass spectrometry, they did not have even a PCR machine. Okay. But I got trained in all these techniques. And was I able to get trained? Yes. There is always a possibility of you getting trained in whatever technique you want, provided you have an interest in that. So the college does not matter. As a matter of fact, I would say the course also does not matter, provided you have a passion for that course. So throughout my 3 years, I was enjoying the course. In the way I was able to be involved in the management of the patient. And soon after the course, I joined government service only because of the mandatory 1-year bond. And I joined at Madras Medical College as an assistant professor. And during that 1 year, my plan was to be there just for 1 year and then to leave MMC and to go and get involved in inborn errors of metabolism screening. But in that 1 year, I realized that the diverse clinical material that I was seeing at MMC could not be seen at anywhere, in any other place. So there I stayed for 7 years. 7 years, I did not take a promotion. I did not take a transfer. I was there for 7 years as an assistant professor because I was like, as I said, indulged in the management of the patient. Right. And then I got promoted as associate professor. That is when I met Ms. Anu Matori, who is the CEO of Kriya Medical Technologies, wherein now I'm working as director. Okay. So she was informed about me by one of her teammates who happened to meet me in one of the conferences. So ever since then, and she even now tells me that she was courting me in the sense she wanted me to join her organization for a very long time, since I was an associate professor. So I love the energy that she carries and I love her enthusiasm. She's an engineer, but she's into medical diagnostics. She's into creating a space for medical diagnostics. So I started going to that organization as a part-time person. That is when I got involved in developing a molecular transport medium. Okay. This was during COVID, wherein we were using viral transport medium. And viral transport medium causes spread of the infection because it does not cause lysis of the virus. So during second wave, there was a need for molecular transport medium. And our organization was the first to come up with this molecular transport medium. And I was in the design and development of molecular transport medium. And this got used in many places. And that is when I got a kick out of it, truly speaking, a kick out of it, meaning being a part of translational research. You do a research and that is getting translated bedside, and that is being advantageous for the patient, and that is being advantageous for a healthcare professional. And that is when I thought, okay, probably I should rethink about me being in government service. If I want to be in translational research, probably I should diversify from there. And then I was playing a minor role. I wouldn't say a major role. I was playing a minor role in them designing and developing a molecular diagnostic kit for SARS-CoV-2 diagnosis. Okay. And that was a super success. And again, I decided, okay, I think I should be a part of that. And then I took a bold decision to resign my government service and then joined here as full-time. And yes, now I have already designed and developed 2 molecular diagnostic kits, both of which are ICMR approved, both of which are available in the market. They are being used by patients, and to see the number of patients who are getting benefited by the kit that is developed by me gives me an immense gratification, which I don't think will be given had I taken physics or had I taken something else other than biochemistry. So am I happy? I'm totally happy. And if you're asking me, does this course give you money? I know ultimately you can speak philosophies, right? Volumes of philosophy can be spoken about being happy, but ultimately, yes, money brings you happiness. And I don't think there is a dearth for money when you take biochemistry because of the number of laboratories that are coming up these days and the number of corporate hospitals that are coming up. All these corporates and big chains of laboratories need to get accredited. We have something called as NABL, National Accreditation Board for Laboratories. So that NABL organization demands that there should be a biochemist to sign all clinical biochemistry reports. So there is a need for biochemists in the lab. And there is a need for biochemists in colleges. I don't think I have to stress the fact that there are so many colleges which are coming up these days. And then there are so many medical device factories, right? Like I'm in a medical device factory. So medical device factory or in vitro diagnostic companies who are looking for people with a biochemistry background. So I mean, if you have a passion for biochemistry, if you think you can learn this subject, yes, learning biochemistry is not that easy. But if you have a passion for the subject, if you can learn the subject, then sky is the limit. Yeah, there is no dearth for opportunities, be it for you to be happy or for you to get the money. I hope I answered your question.
Right. Amazing, ma'am. Absolutely. I think this is very insightful for everyone. So we got your message that ultimately, you need to focus well on your branch that you opt for and keep exploring. Once you are thorough with your work, you will surely get the opportunities. So now, ma'am, this is a very important point that, like you mentioned that you got married early in your, medical career, and then you managed everything right from internship to postgrad. So in this particular scenario, people, often think that, okay, doctors should marry doctors because they understand the work-life balance issues. So was this true in your case? Did you marry sir is also a doctor, or you felt that, okay, he's not a doctor, but still, he's very understanding, and this brings a very different perspective to life also, that, outside that everything related to medical, you come home and you can talk to some other things also. What is your take on this?
Yeah, during my undergraduation days, for some reason, I thought my husband should not be a doctor. Don't ask me why. I thought there should be some diverse discussions happening at home, and probably I got aversive during my ragging time in college that I didn't like many of my medical seniors. So I was too young. I got married when I was not even 21. So I had a strange way of choosing at that point of time. So I decided that I don't want a doctor as my life partner. And I and my husband, we know each other for a very long time. And it's, I won't say it's a love marriage, it's a love come arranged marriage. And him being my life partner has been a blessing for me in multiple ways. Till now, he has never told me no for any of my attempts. For example, me choosing biochemistry was never opposed at home by him. He would say, whatever you want, you choose. It is your life. It's your choice. Do it. Go ahead. And then me joining government service. He was working at Melbourne when I finished my post-graduation. So he was hoping that I would, soon after post-graduation, he was hoping that I would I would join him at Melbourne. I even wrote Australian Medical Council Specialist Pathway. I cleared it. And then I was about to go and join him. That is when I thought, for 2 reasons, I did not go. One is my heart is in India. Second reason is I did not want to start from the scratch. I had already established myself in India by then because I started teaching for post-graduation aspirants even before I started attending my first class as an MD postgraduate student.
Okay.
So yeah, so after I got MD biochemistry, I was asked by Speed Institute here, and he asked me to take a class. So I had not even attended one class as a student in MD biochemistry. I went and took a test and discussion session. And ever since then, I've been teaching post-graduation aspirants. So I was established by then. And I did not want to go to a new place and start from scratch because I was told that after that, I will have to do 3 years of residency. After MD that I finished here, I'll have to do three years of residency there. So I thought, okay, this does not seem like my pathway. So I said, I told him, you be there, I'll be here. Let's find our own paths. And at one point we will meet. It's not like, I mean, we were together, but I told this.
Right.
But he decided, okay, if you have decided to be in India, let me come back to India. He came to India, and I mean, these are just few examples.
Right.
And bringing up my daughter, I mean, one of the reasons why I joined biochemistry is I thought I would be free, but totally contrast is what happened.
Right.
Because I started teaching even on weekends. I never used to be at home. I used to travel, and it was him who brought her up. Had I married a medico, he would have been busy on on one side. I would have been busy on the other side, and the poor child might have suffered. But he was always there. So what used to happen is evenings I used to come back. I used to take care of her. On weekends, because he's a software engineer, so he used to be at home on weekends. He used to take care of her. So it was a well balanced life for us with respect to bringing up my daughter during the early days. And now, I mean, I would many a times I would say I'm at Bangalore to take a class.
Right.
I mean, or I would say, oh, this Friday I'm not at home because I'm going to Delhi. Or next week I'm not here, I'm going to Cochin. This is the kind of information that I give him. But he has always been such an understanding person, and he takes more pride than me in whatever I feel. So I would say that's the best decision that I made in my life. And for all of you, if you're thinking, should I marry a medico? Should I not marry a medico? It's up to you. And if you have a choice of marrying a non-medico, please go ahead. You can be, the life will be balanced in a way.
Right. I think that's really great, ma'am. And throughout the insights that we have got is basically those who are right now preparing for, NEET PG and are following ma'am as well. So give your best shot, and because often once you give the exam, you get the rank, then your thought process change. So let's not worry. People worry a lot about it. I want to get this particular seat and then mess up the result, mess up the exam day. So it's better to go free-minded, and if you are passionate, then you can surely do well in anything that you want. So ma'am, I think that was really great. We would like to go with a fun rapid fire contest at the end, so that viewers can know more about that. So if you had a superpower, what would it be?
I would like to be a life hacker. Life hacker in the sense I would want to know 3 steps ahead of everybody's life. So that I can say, I told you so.
Right.
And yeah, I can be a mentor for everybody. I can say, you follow this path. This is what you're going to face in another 3 years. I
Right.
can be a mentor for every student I meet. I would want to be a life hacker.
Right. Amazing. But then you would also know the negatives of their life as well. But yeah, you can warn them about that.
I can try. Yeah, I can try.
Right.
I can try helping them avoid it.
Right. Next question. One thing you always carry in your bag.
Actually, I don't carry a bag at all. I mean, unlike many girls who carry a handbag, I just walk with my phone. But if at all I'm carrying a bag, it's a laptop bag, which will have my laptop and my iPad. Nothing else.
Right. What is your dream travel destination, and have you traveled there or you want to travel there?
I have not been there. I'm an avid bird watcher. One of my hobbies is watching birds. So I would like to go to Ecuador. I have not been there. Yeah, that's a heaven for bird watchers.
Okay, great. So I think we came to know that, okay, now if you are stranded on an island, you would want birds to be there. What are the 2 things you want, for the island to be there?
If I know I will get stranded in an island, I wouldn't go there. Okay, hypothetically speaking, what would I take along with me? A Wi-Fi router with connectivity.
Right.
Probably, what else? A binocular and a camera. I would.
Right. Great, ma'am. And now if we go back 15 years, 15 years earlier, would you still opt for biochemistry, or now you want to try another branch also?
No, definitely biochemistry. I wouldn't want to try anything else. I'm so happy about choosing medicine. I'm so happy about choosing biochemistry.
Great. So I think you have become a life hacker, at least for yourself. So that's really great. So at the end, ma'am, I would like to, bring this to the notice that everyone, please take care of your mental health during the entire, medical journey, because it's really a long journey. And as you listen to ma'am, there are immense options available. And if you're really passionate, then you can surely make your way. Thank you so much, ma'am. Any conclusion message that you want to give to our viewers?
I would want all of you to have one vision in life, one mission in life. It is to be happy. Right. So ultimately, if you have that as your goal, as your ambition, I would say, I mean, everything else will fall in place. Try to be passionate about what you do, be happy about what you do, and yeah, and you'll be successful in life.
Right. Amazing, ma'am. So thank you so much for, being a part of this podcast. And now viewers, it's up to you. You can either, attend 10 patients in an OPD, or you can also get, some diagnostic tests that are being used by millions now. So it's up to you to create an impact in which you feel you can create impact more positively. So thank you so much, ma'am. We are surely enlightened with your vision, and we all are really inspired. Thank you.
Thank you so much, Akshay. Thanks for having me here. And I had a great time for the last 40 minutes conversing with you.
Yeah, thank you so much.